Coming up.
Believe it or not, I did it without extraction.
Wow.
Extract any teeth.
I can't get over
Okay.
it. You guys have to watch this if you're not watching.
No extraction, 8 months from here to here. 4 months. Again, this was COVID, actually 90 days would done.
Wow.
Are you kidding me?
She said, I want you to fix my teeth. And I have been told I need jaw surgery and I don't want to have jaw surgery. And she had about, I think, 8 millimeters of underbite. She was told that she needs double jaw surgery. And she already had orthodontics as a teenager, and 4 of her bicuspids were extracted.
We have a special offer for our Munch Bunch listeners. To book a virtual consult with Megan, she's offering a discount of $25 off. Just email her, Megan, at nwmyofunctionaltherapy.com or through her website, www.orofacial-myology.com. To book a virtual consult with Kimmy for the $25 off, email her mouthmusclememory@outlook.com or through the website, www.mouthmusclememory.com. Now on to the episode.
Hi, everybody. Welcome to the Munch Bunch podcast. It's Kimi Nishimoto with my homegirl, Megan Van Noy.
Hello.
And today we have Dr. Mary Afzali. Dr. Mary has practices called Lifetime Dental. She's in Lake Forest in the Orange County area, Rancho Cucamonga, San Bernardino, and then Riverside, California.
Woohoo.
And what's amazing about Dr. Afzali, I'll let her give a little explanation about who she is, but she can do these incredible expansion cases in a very short time period. She showed me her cases before, and I'm like, Mary, this is like impossible to do in this short of time, but she does it, and people have great, amazing results. So we wanted to have her come on. We'll highlight her. Do you want to just start showing us?
Sure, absolutely.
Okay.
Yeah. So would you like to see another case?
Oh, I'm giddy right now. I'm giddy.
So this is another patient that at the time when I saw him, he was 13 years old, and his father came to me and said, I need your help. Any place that I have taken him, they want to do jaw surgery for him. Don't want to do jaw surgery. And basically, his lower teeth were hitting his palate.
Yeah.
There was no connection, there was no contact between upper and lower teeth. And you see, it was severe deficiency in the premolar area. And this was very severe. And again, I look at the palate, you see where the deficiency comes from, right in this area. So I had to take a very gentle approach to this case, because when you have this much of an overjet, if you're not taking your time and if you don't really care for the case and do the right action, there is a chance of root perforation because if you go aggressive. So I built the foundation from the back and gently recontoured the front. And when I reached to the point that it met with patient's ability to comply, because we got to the point that really our only treatment was him wearing his elastics at home. And it wasn't the easiest thing for him. So we went back and forth. And then I decided, to take our games. And this is what we ended up with.
Wow.
Which you can see, these bones safely from this. We got to this,
Oh, wow.
and this is
Mm-hmm.
like, and I show you the palette.
Yeah.
Look at this palette.
Wow.
Compare.
We'll take it. We'll take it. Sign me up.
Was he a thumb sucker when he was younger, or how did the palate distort so much?
Yeah, how did he get that way?
The father, they were from a different country. The father didn't have much of a knowledge about, these type of habits and things like that. I couldn't get a very good history, but you see the difference between this palette and that palette,
Mm-hmm.
the arch form.
Mm-hmm.
So now his face looks really good. And again, with this type of cases, I like to do the IPR to the point that patients get the function back and they're happy.
Mm-hmm.
I don't like to go and do more IPRs and things like that. But you see again the areas of contact type.
Mm-hmm.
So
Keep the food out, keep the plaque out, less cavities, less gum disease.
you see, and that's what we accomplish, and that's the lower
Wow.
focus. Okay.
And were you using an expander, or was this fast braces only?
Only fast braces.
Oh my
Wow.
God, you're so cool.
Thank you. So this is a case that came to me in this situation. And she had this impacted canine on the upper left. And unfortunately, after she was on braces for 2 years. Then this was after 2 years of being on braces.
Wow.
Wow.
And they were not happy. So they found me and they came. But unfortunately, 4 bicuspid were extracted.
Yeah, I was going to say, I'm not counting all the teeth.
Yeah.
I'm not counting this, right?
And the patient, 14 years old, had a retracted cheeks, and really the bite had collapsed. Let me see if I can show. This is after. This was her lower jaw. You see the collapse in here where the bicuspid were extracted.
Yeah. I've always wondered about that, because people that have had bicuspid extractions, they always have inflammation behind their canines in between those teeth.
It's like such an awkward angle.
Exactly. So fortunately, I was able to help her.
Wow.
And her palate, although the bicuspids were extracted, we ended up with a decent palate. And this is what she looks like.
Nice.
You see the lower was restored. You see the after the canine. Still, she does have some, but it improved drastically.
Right. Now, do you have cases sometimes where you get back that premolar space and then you do implants, or do you just kind of bring everything forward to get to that?
That's a fantastic question. And I tried for this case, but you also, and again, I pretty much let the body to guide me, especially for a case that for 2 years was already on braces. The family were exhausted mentally.
Right. Okay. Yeah, totally makes sense.
And financially. And yes, that was, if in an ideal world, yes. I could create the space. But my concept is that as much as I'm a perfectionist in creating the ideal occlusion, ideal space for the tongue and airway and all of that, patient's comfort at different level, financially, emotionally.
Mm-hmm.
Is
We have
not
to put
one.
patients
You know, I
first.
need, yes, exactly. And
Yep.
they
Preach
were,
it. Preach
yeah,
it.
they were thrilled with the results, and
Yeah.
I was happy with the results because you can see the difference between the lower before and after. I showed the before, what she looked like. It's not like this. Yeah, I went through the different ones, but basically, let's see. Yeah, you see is how much it was and what we gained.
Yeah.
So nice case. They were thrilled, as I said. I was content with what, under circumstances, we did the absolute best.
Yeah. Dr. Afzali, can you go back to her panel? I have a question about canines. So in traditional ortho, if you have an impacted canine that's like stuck in the palate, for example, or if it's in the buccal area and they do the expose where they do the surgery where they kind of open it up, put a chain and then pull it down. I have noticed that those teeth that have had that history of like the traditional ortho with the chain when they pull it down, that the gum just never is quite right. It's always a little bit more inflamed. The tissue looks kind of thin. What is the difference that you've noticed with like the fast braces technique pulling down canines versus like traditional ortho?
You know, to answer your question, I have to have a case study, you know, of many of these cases to come up with the conclusive answer to your question. But going back to look at this case, you see the canine, or let's look at this canine on the left side. It looks very decent, doesn't it?
Yeah, it looks great. It doesn't look
You wouldn't tell.
inflamed.
So I guess it all depends on how you rebuild the bone around that area. Again, comes to bone formation. It comes to alveolar bone formation. And as we are gently bringing this, one other thing I tell you that I strongly believe is working for my patients, and it's working in the direction of my ideal treatment, is I go super gentle. And each part of, although all the teeth are connected with wire and braces in the mouth together, I am very sensitive and very perceptive about every single tooth. And if I sense that something is not ideal for that region, for that situation, I modify it. I slow the case. I give support to that area by lacing. So, you know, you just have to be really very much involved with seeing how everything is moving, and at the right time, do the right action. And to answer your question about these, I am super gentle. And because why am I super gentle? Because I want to create amount of stimulation to the bone that enhances the circulation, it enhances the oxygenation, as a result, enhances the bone formation. If I go too fast and I create too much inflammation, then I'm interrupting the creation of bone. You see, the process of orthodontics, in a sense, it is an inflammatory process. In a sense, however, that inflammation is toward formation of the bone, creation of the bone. So if you take a very gentle approach to that and handle it with that care and are very careful on each area, don't look at the whole thing, look at every little detail, then you can be present and do the right thing at the right spot.
We want to introduce the Spot for Tots course, a parent's guide for toddlers ages 2 to 5 for mini myo. We have Megan and Kimmy going over nasal hygiene, myofunctional exercises, breathing exercises, tongue-tie healing protocols, and then we have Jenny June going over sleep hygiene and Kelsey Baker going over feeding therapy and bodywork. The course is $297 and the link will be in the description.
So how long would you say, it's probably patient dependent, so I know that, but I would say, like, what are your average kind of patient case lengths then? Like, how long are you usually having patients in fast braces?
Sure. Let me share with you this case study book to answer your question with this, because this has the types of cases and the length of the time. Some of these are a little bit marked longer.
I love this. This is so cool.
Yeah, this is 6 months going
Wow.
from here to here. And another thing that you see, again, I love to have wide and beautiful smiles. And by widening the palate, you get this beautiful effect. 6 months. This case was, she was told that she needs double jaw surgery. And she already had orthodontics as a teenager, and 4 of her bicuspids were extracted. And that was the day that I saw her. You can see the black triangle. You can see the facial posture and skeletal posture of the face. And then this is after 14 months. And of course, we had that 2 months of lockdowns with COVID. I couldn't do adjustments on her.
But still.
14 months compared
but still
to
that in 14 months.
Yeah.
Yeah, and then double jaw surgery. Yeah, and then if you look at this, you see the nose lifted. You look at the eyelid, the distance
eyes
between the upper eyelid and the eyebrows. You know, just the forehead goes. And this is before and after. She told me people asked her if she had a facelift, and she did have a facelift.
Kind of, yeah, kind of.
Because, you know, basically we built the palate, the upper. And I have the pictures of her palate and expansion of that, but in this case, the study book, that's all I have. So this is another patient. It took 9 months because she had this tooth that was not salvageable, and she had a wisdom tooth. Number 1 was here. So it took me about 2.5 months additional, about 3 months in addition, to move this second molar in place first, and then use her wisdom tooth. And she saved about $7,000. And she needed a face sinus lift, an implant, and restoration. And you know, that's how much she wrote because she was so thrilled.
So this is amazing.
Wow.
Yes, and then when you see the palette and this is interesting. Look, how tongue was constricted, and now the tongue is just has room coming out.
It can fit, and her cheekbones look wider too. It is like
absolutely, and it became, she lost the volume where it was, you know, and made this look, and then the cheekbone came a little bit more dominant, because now her bite is a vertical chewing, and when you have the correct bite, then every time you're eating, you're exercising, you know, the muscles are exercising. You would not have this you know, bulk of masseter.
Wow, unbelievable.
I can't believe it's 9 months. This would be years and years.
Yeah, and then 9 months, as I said, 6 months she would be done, but 9 months because of that movement.
You are a goddess.
Thank you. And this is something.
Wow. Look at that.
Really, even if I had done just this one case,
Mhm.
else, I would be thrilled.
Look how happy she looks in her
Professional.
after.
Yeah, this lady, she's amazing. I love her so much. And
Oh.
again, this was during COVID time, so I didn't get to see her for a period of time as much as I would like to, but it's still 8 months. And she had this huge overbite. Again,
Mhm.
the palate was a V-shaped palate, and she was
Mhm.
told surgery is her option.
Mhm.
And she was on a CPAP machine, and you can see the carotid artery.
Mhm.
You can see the stress in the face,
Mhm.
and you can see the neck afterwards and the
Mhm.
eyes.
She's just so much happier. Like she just looks so much more full of life.
Yes, and she's saying that I no longer need my CPAP machine to sleep at night, and lost 100 pounds.
Wow.
It's amazing.
Yeah, just
You're
she
a
could sleep
miracle
well.
worker.
She could sleep better, and she no longer having a sleep apnea.
Wow.
Wow.
In this case, of course, the apnea was in the upper respiratory, was created
Wow.
by the apparatus that was within my zone of, expertise, and I'm thrilled that I could help her. This patient was going to have joint surgery because she was in excruciating pain.
Mm-hmm.
And her husband knew my husband, so she came just for a second opinion to see me. As soon as I saw her bite, again, this is another reverse curve of SV. I told her, I can help you and you don't need any joint surgery. I put her on fast braces, and immediately, in a matter of really days, her pain was gone. And that's what
Wow.
she wrote. I know sleep better. My TMJ and migraine pains is gone. No surgery. Just
Wow.
brace.
It's
Yeah.
amazing.
Yeah. And
Oh.
this is the case that Fast
Wow.
Braces awarded me with the Athena, with their global award
Wow.
among thousands of doctors in about 100 countries around the world. They look at one case, and so far they have given this award only to 4 doctors, and I've been honored that I am one of them.
Woo!
Get it, girl. Get it.
They look at thousands of cases every year, and then they select the most challenging, the most impossible, the most difficult case, and in a shortest period of time. And this case, you see that basically the whole upper jaw was inside of the lower jaw.
Mm-hmm.
Mhm.
It was tremendous and severe TMJ pain.
I
Mm-hmm.
believe it.
Yeah, and 11 months we went from here to here.
It's amazing.
No
Because
TMJ pain.
how many times did he have ortho in the first picture?
You mean this one? 3 times.
Uh-huh.
After 3.
Wow. Wow.
After this, yeah, after this fast braces was the 4th attempt.
Wow.
Wow.
And this is just a simple case, but I put it in because it was fun. And again, we got
Still, it's beautiful.
COVID, and then she went to Canada for a couple of months. So it took longer than it should have had. This would be a 6-month case. But see, I go for the second molars too, to give that white, beautiful
Mhm.
that. And she's just beautiful, a very beautiful girl, and such a pleasure to give her the beautiful smile she wanted. This was another patient that was told needs jaw surgery. Again, you can see the palate,
Mm-hmm.
and then no jaw surgeries. Just 10 months.
So amazing, because those crossbites can be so hard to
Mhm.
correct.
Oh, look at that little cutie.
Yes, and this picture, this I put it in because this was a simple case. It was a spaces, nothing surgical about it, nothing about extraction or anything. But when you restore function, when you restore the function of the eye teeth, the canines, restore the function of front teeth, and you support the joints, see what happens to the eyes, what happened to the nose, what happened to the look.
Mm-hmm. It could grow out and forward.
Yeah.
Beautiful.
And also all the cranial nerves, the cranial nerve, that the facial nerve that supplies the orbit, wakes up.
Mhm.
You make the mouth is in function, the teeth are in function, and then as a result, the muscle are functioning, and then the nerves wake up, and then that's what you see.
Mm-hmm.
You see, even in a simple case like that.
Is this a fast braces case, or was that
Yes.
Healthy Start?
No, that was a fast braces also.
Wow.
This
Wow.
case is, believe it or not, I did it without extraction.
Wow.
Extract any teeth.
I can't get over it.
Okay.
You guys have to watch this if you're not watching.
I know. Go back, watch it.
And again, the palate was crooked, very
Yeah.
crooked. And you see that the lip had asymmetry, and this is afterwards.
Wow.
People ask her if she had fillers or Botox. And, when you restore function, then the soft tissue follows the hard tissue.
Wow. Did you use an expander as well as fast braces, or was this fast braces only?
No, it was
Wow.
braces.
Oh my God.
Basically based on alveolar bone formation to accommodate these teeth and IPRs on the back.
Wow.
Yeah, to create the ring.
You are a magician.
Truly. Truly.
So this, I think, as a hygienist, Kimmy, you appreciate that.
I want to clean it. Like I'm grinding my teeth. I want to clean it.
This was after SRP.
Wow.
After SRP, after irrigation, I'm not sure if after laser or not, because I know that we did laser for her also. And non-responsive, basically. And this was the palate. And this is, again, this went into COVID also. And this is what happened. The bite got resolved. And this, no perio, no gum graft. Just bone was restored and gum came around with it.
Yeah.
And
which is not technical, which is, they say, is not possible. But look at you over here.
Yeah.
All the things we didn't learn about in school, huh?
This was the day she had the braces removed. You see?
Wow.
And no, after even wearing braces and gum becoming in this condition.
Yeah.
So.
Wow.
Yeah. And this is another patient, no extraction, 8 months from here to here.
Oh my gosh.
Yeah.
Because you're looking at probably, but most orthodontists look at that and say surgery as well.
Surgery.
Yeah. In fact, she was told. She was told. Yeah. And this is this. I put it in my case study book for the purpose of showing how you can really avoid future dental work if you have a diagnosis and you act and you take care of it in a very simple manner.
Yeah.
The function of the canine was missing here, here. And this was the palate.
Right.
Deformed.
4 months. Again, this was COVID, actually 90 days would done.
Wow.
Are you kidding me?
No, 90
wow.
days. Yeah, absolutely. Yeah.
Oh my gosh.
Yeah.
I'm losing it over here, guys.
Yeah.
I know.
4 months. And you see this.
Wow.
Yeah. Wow.
And
you're just so nonchalant too.
This patient has bought an insurance with this, has an insurance
for
her mouth with regular hygiene care
Mhm.
and good oral hygiene practice at home, she would not have any dental problems.
Yeah.
That's amazing. I've been thinking about that so much. Like doing hygiene is like, we nag everybody to floss and brush and stuff. And it's almost like if your bite is not right or if you have bruxism,
Mhm.
you're just going to be fighting a losing battle.
Mhm. Oh yeah.
So setting them up for success like this is so huge because this
Yeah.
is so much more easy to maintain.
Mhm.
All right.
Yeah. And this lady,
Wow.
yeah, she came to me and she said, I want you to fix my teeth. And I have been told I need jaw surgery and I don't want to have jaw surgery. And she had about, I think, 8 millimeters of underbite.
Wow.
Years back. And she couldn't hear well and she couldn't articulate well either. And she
Mm-hmm.
Mhm.
TMJ. So I took really baby steps with her. It took 20 months because I wanted to really give her the absolute best. And this is what we ended up.
Wow. Unbelievable.
It's
Yeah,
amazing.
that's what she said. She said, I regained my hearing, ability to talk better, and my severe pain in the jaw
Wow.
went away. And in fact, when we were, I would say about 3 months into the treatment, she came and she said, you know what? I was talking with my sister over the phone, and she said, I can understand you better. And my
Wow.
jaw is not hurting anymore. It's
Wow.
incredible that this case, going through the jaw surgery, I thought about it a lot. I couldn't see how she could regain her hearing, better articulation. Probably yes, better articulation, probably yes, she could. But regaining the hearing and
Mhm.
TMJ, I couldn't think how it could be possible because the joint would not be addressed. It would be probably the jaw would be fit to the current position,
Right.
to what she had. This is just my thought process because I'm so passionate about what I do that I think thoroughly through my cases.
Yeah.
And try to look at different scenarios and see how it could be this way or that way. And I couldn't think how that could help with hearing and
But you put her jaw in a better position. She probably had less pressure on all those nerves and blood vessels in her ears. And
absolutely. And she looks fabulous.
Wow.
She looks younger and she, it's
Love
just
it.
like life-changing, honestly, really life-changing for these people. So,
wow.
yeah.
I think we're gonna have to have you back on for like a part 2 because
Yes.
this is just so
Yes.
so amazing, and I
Yes.
want to make sure that we can cover more because I would love to talk more about all the meridians. I love that
Mhm.
stuff.
Yes, absolutely. Absolutely. So, Dr. Afzali, we told everybody where you're located, but how also can they find you on social media? Where would they find you?
This is my IG, Dr.Afzali, and my Facebook is Dr. Afzali.
And then the name of your practice is?
It's all of them are Lifetime Dental,
Perfect.
and then they are in Orange County, Lake Forest, Rancho Cucamonga, Riverside, and San Bernardino in Southern California. All 4 of them.
Mm-hmm. And when we have you come back for part 2, I would love to hear about how you help the little kids now too.
Yeah, the little kids, and then the meridians, the teeth compared to different organs in the body. Yeah, that would be amazing.
Sure,
Yeah.
absolutely. In fact, what I love to talk about is how I help my young patients, the ones as young as 3 years old. Honestly, I love to see patients at that age because
Perfect.
some of them, I can even help them without braces.
Mm-hmm.
And or if they need braces, would be minimal.
Yeah.
Mm-hmm.
Love
Yeah.
to do that. Thank you, ladies.
Thank you. Absolutely. Oh, thank you so much. Yes, you guys will have to catch us for another episode with Dr. Afzali because, man, she just has so much
I
to
know.
share with us. And when Isabel turns 3, I guess we're just going to go live in LA for a few months. We'll find a long-term Airbnb to come see you.
Honestly, it might be worth it because like people spend so much more
Oh yeah,
for this.
it's already cooking in my brain here. So, and of course, you guys can find Kimmy and I on social media at the Munch Bunch Podcast. You can find me at NWMFT and Kimmy at Mouth Muscle Memory. Thank you again, Dr. Afzali, and we are looking forward to chatting with you again soon.
Sure, absolutely. Thank you so much for having me.
Absolutely.
Fun with both of you. Yes, absolutely. And I love to come back. Thank you, Kimmy, also.
Yes.
Okay.